Carolina Foot Centers Instructional Video, Cam Walker Application. This educational video is intended for Carolina Foot Centers patients who have already been instructed by their provider on using a Cam Walker boot. It does not replace personalized medical advice, diagnosis, or treatment. For educational use only, the following demonstration is meant to refresh instructions given during your appointment. Every foot and injury is different. If you have any questions or concerns about applying your Cam Walker, please contact our office or your healthcare professional before proceeding. No doctor-patient relationship created. Watching this video does not establish or modify a physician-patient relationship. For new injuries or symptoms, do not rely on this video. Consult your doctor or emergency services promptly. Safety precautions. Wear a clean sock, sit in a safe position to apply the boot, and follow the specific tightness and fit guidelines provided by your provider. Do not adjust or modify your boot beyond the instructions you were given. Stop if you experience pain. If you experience pain, numbness, swelling, or changes in circulation while applying or wearing the boot, remove it and contact your physician for guidance. No guarantees or warranties. This video is provided as is. Carolina Foot Centers is not responsible for injuries or complications from improper use or application of the boot. The wearer assumes responsibility for correctly following professional medical advice.
Let's get started. Number 1, sit down in a safe and comfortable spot. Sit on a chair or bed with your foot flat on the ground. Make sure you are stable and relaxed before beginning. Number 2, put on a sock. Wear a clean, dry, thick sock that covers your entire foot and lower ankle, preferably to the lower leg. This helps protect your skin and keeps the boot from rubbing. Number 3, open the boot. Unfasten all Velcro. Open the boot wide. If your boot has a hard plastic front shell, remove it and set it aside. Number 4, place your foot inside. Slide your foot all the way back into the bottom of the boot. Your heel should touch the back and rest flat. Make sure your toes are not hanging over the edge. Wrap the liner around your foot and lower leg so it fits snugly and evenly. Number 5, place the front panel. Gently place it over the liner. Make sure it is centered and not pressing unevenly on any part of your leg. Number 6, secure the straps and inflate the boot. Begin fastening the straps from the bottom. Pull each strap firmly so the boot feels secure, but not tight or painful. Once the straps are fastened, press the pump several times to inflate the air pockets around your foot and leg. Find the air pump bulb or button, usually located on the side or front of the boot. There is a dial labeled inflate and deflate. Make sure the dial is turned to the left to allow air to inflate. Air provides a more secure, customized fit and better support while walking. Do not overinflate. If the boot feels too tight or causes discomfort, turn the dial to the right to deflate or valve to release some air. More air in the boot may be needed while walking to improve stability. Some air may be deflated while resting to allow for better circulation and comfort. Inflate and deflate as needed throughout the day, especially if you notice swelling or changes in fit. Number 7. Stand and check the fit. Slowly stand. The boot should feel stable and supportive. If it feels loose or uneven, sit down and recheck the straps and air pressure. Some helpful tips. Wear the boot exactly as prescribed by your doctor. Do not walk without the boot unless you have been told it is safe to do so. Check your skin each day for redness, pressure marks, or blisters. A shoe balancer or even-up shoe on your other foot may be needed to prevent hip and back strain. If there is any new pain, numbness, or swelling, remove the boot and contact our office. Begin your journey to healing. With a little practice, your cam walker will feel like second nature and you'll be one step closer to smooth sailing or strolling.